So today we are going to have an assessment for the head and neck. So as you can see, the head and neck, we are going to assess that. So sir, I am going to assess your head and neck. Huh? It is important so that we could know if are there any problems with your head or your neck. So we must check first the facial expressions. So are there any signs that he is having involuntary muscles, which is he may blink like fastly, or like are there any um, asymmetry, which is his nose is like pointing like that, or like his head or like his mouth is like doing like that. So I think the patient is quite normal, so we are good with that. So just like the skin assessment, we have also must check if are there any lesions, nodules with his head, and so like he has acne for hormonal imbalances because of his puberty, so it's quite okay. And then the moisturity of the patient is also good, so we have no problem with that. So is his external eyes okay? The structures, the eyelids, so I think it's quite okay. Then the eyelashes also, I think it's healthy. And then we are going to check his eyebrows, so it's quite okay also. And then the eyeballs, we are going to check the eyeballs. Okay, so we have to check if the eyeballs has jaundice. So jaundice is like a yellowish color of the eye. So if the patient is having like that in the sclera, so meaning he has hepa B or hepatitis B, so our patient is quite good. His sclera is white and okay. And then we are going to check his conjunctiva. So it's okay also. The patient's conjunctiva is not red, like really red, and also not that pale. So it's just pink, so it's quite okay. And then we have to check the sclera, it's a good. And then the symmetry and the alignment of the eye. So some of the patients is having strabismus, so or like kanang in the Bisaya term, it's like buwag ang mata or libat. So I think the patient's eyes is quite good, and it is aligned, maybe 3 inches or 3 centimeters away from the other eye. So it is quite good. And then we are going to check the pupil and the iris. So I think it is good also. So in the hospital setting, we must use pen light, but since we are on in the province, we don't have pen light, so we are going to use flashlights from the cell phone. So as you can see, his iris is his pupil is constricting, and this one also, and his pupil and iris is good, are good. To test for pupillary accommodation and convergence, ask the patient to focus on an object as you bring it closer to the nose. Focus na sir ha. Okay, so the patient is good. He is focusing at the pen, and his eyes met at the center. Okay. So using an ophthalmoscope, we must check the red reflex of the patient. But since we have no ophthalmoscope, we should eradicate that, and we should proceed to the next part. We should also check the visual acuity of the patient, if his eyes is good, if his vision is good, if he's having a 20/20. By using it, we need a Snellen chart, but since we don't have, we will use random words so that our patient can read. So this is like 20 feet away from the word. So sir, kindly read or kindly say the letters. Yes.
EXPRESSIONS.
Okay, so like the patient is having a 20/20 vision, since he can read spontaneously the letters. With the patient about 2 feet away, ask the patient to focus on your finger and move the patient's eyes through 6 cardinal position of gaze. So the patient's eyes are very good and is healthy. So the patient's eyes move whenever my pen is located. So it is a sign of a healthy eye condition. So we are now down to his ears. So we, as like the formalities, we should check if are there any asymmetries, the shape of the ears, is if it's good. So I think it's good. So outerly or externally, the patient's ears is in good shape. So there's like a mole, but it's okay. We should also check his mastoid process here, like the hump here. It is a mastoid process if it's tender or like soft, but since the patient's mastoid process is hard and good, so we are, it's okay. And now we are going to check the inside of the ear, the internal part of the ear. We are going to use an otoscope, and it is a machine used so that the doctor could check if the patient's ear is healthy or has any pus. But since we don't have any otoscope, we should use a light, and we should check the internal condition of his ears. Like the patient's ear is good and well. Now we're going to check if the patient's ears is good. Like, yeah, we're going to test his hearing. So I'm going to cover his ear here, and then I'm going to say something, and then he will going to say it again. What did I say?
Gwapo ka.
So this one also.
Sana all.
Okay, so the patient's hearing is good and we are on to go. Next part, we are going to check his nose. So again, we have to check if his nose is good. Are there any bad shapes or asymmetries? So I think it's good. His nose is pointed, straight, and then, okay, there are no broken bridges or any lesions, lumps. Okay, so we are going also to check his sinuses if he's having pain in his sinus. Nice, sakit sir.
Wala.
Kana.
Wala.
Kana.
Wala.
So I think now he has a good or a healthy condition of his sinus. We are now going to check if his nostrils are having some obstruction or sort of like cyst that is growing. So we have to cover his right nose, and then I will ask the patient to blow his left nose, to blow out with his left nose. Okay, sir, blow. Okay, so there's no obstruction. So the right nose. Again, sir. So, naa ba kay mga flu or sip-on?
Sip on.
Okay, so I think it's the patient's condition now is he's having a cold and he's having a runny nose, so his right nostrils is having obstruction, but it is still good. So we will check his nostrils if there are any obstructions by using otoscope, but since we don't have otoscope, we should be resourceful and just look for any obstruction. So it's good. His cilia is doing great and there are no obstructions. The color is pink and it's okay. Second to the last, we are going to assess his mouth. First, you must check the outward appearance of the mouth. So we are going to check his temporomandibular joint, which is located at the front of his ears. This one. So sir, kindly open and close your mouth. Okay, so his temporomandibular joint is good. and in right condition. So palpate also his here if there are any soft tenderness or lumps. So it's good. And his lips are no having signs of or doesn't have signs. So the patient's lips have no signs of lesions or lumps, so it's quite good. And then we are going inside of the mouth. We must ask the patient to open his mouth, and then we should use a tongue blade in the hospital setting so that we could palpate his mouth. But since we are in the province, we should use a fully sanitized toothbrush, the back of the toothbrush. So we are going to see if are there any mouth sores or sort of like that. Okay, so as you can see, so our patient is having braces, so I think she is regularly going to the dentist for adjustment. Okay, there are no mouth sores. I can see there are no mouth sores. We should also check if his teeth is having cavities and tartars. So, but since he is regularly visiting his dentist, I think he is having cleaning every time. And so his mouth is pink. And gums is good, so it is good. And now we are going to check his tongue. So sir, if mutuslok ko din he bida, i-pull daw ang kaning toothbrush. Okay, if then he i-pull. Okay, so his tongue is doing well. Okay. Must also check his ovula, the bell. So sir, daw Okay, so it's good. So his mouth is healthy, his tongue is pink and good. So we are okay. In assessing the posterior neck, we must check his posterior triangle of the neck and the posterior cervical lymph nodes using the finger pads in a slow circular motion. So this is his lymph nodes, and we're going to circularly palpate this to see if are there any lumps or nodes or humps, because that is a sign of goiter, which is your lymph nodes is growing bigger or has lumps. So I think it's good. And then inspect and palpate in front of behind the ears. It's a mastoid process. Okay, it's good. Under the chin. So there are no lesions or any sort of like that. An anterior triangle, an anterior cervical lymph node. So we should also check the both sides if it is symmetry or symmetrical or like having a good shape or like it's the same. So it is good. His neck is okay. Now we are done with our head and neck assessment. So that is how to do assessments in the head and neck. So thank you for watching and God bless.